If you're on food stamps and EBT, here are 4 changes and updates you need to be aware of. Let's get right to it. So, if you are one of the 72 million people on Social Security, I have some announcement. The 2025 COLA changes have come out, and a lot of people are not happy because of how much their Social Security benefits is going to go up. So, if you're on food stamps and Social Security, or you know somebody that is on Social Security or disability benefits, you need to pay attention. And then I have 10 major changes that are coming up for Social Security recipient that's going to affect everybody. And then I have 5 EBT discounts that most people aren't aware of, and therefore they are not taking advantage of these amazing benefits. I'm going to give it to you shortly. And if you stay till the end of this video, I have 20 financial assistance programs that every senior that is low income should be using, but majority are not using because they simply do not know that these programs exist. And I'm going to walk you through all 20 of them. It's going to be worth your time, I promise. So let's get started. So if you're new to this channel, I want you to hit the subscribe button, because if you like to see content like this where we bring you the latest news and updates, anything in and out of Congress that will affect your Social Security food stamp benefits, we want to be the first to bring it to you. Hit the subscribe and like button. So let's talk about COLA. Now, what's happening is that every year the cost of living for Social Security benefits are adjusted because of inflation. This year, not everybody is happy about the COLA amount. The government, the Social Security Administration, released the COLA for 2025, which is going to go into effect in January, and it was an abysmal 2.5%. You heard that right. The cost of living adjustment for Social Security is going to be 2.5% next year, starting in January. Now, if you compare that to pandemic era changes, it was 5.9% in 2022, 8.7% in 2023, 3.2% this year in 2024, and as you can see, it's gone to 2.5% in 2025. So when it peaked at 8.7% in 2023, it's been going down since, and the trend is not going to change. Now, if you compare that to historic numbers from the last 15 years, you will see that 2.5% is not actually that bad, unless you take into the fact that food prices have gone up and stayed up since COVID. And so those prices have not come down. So people on Social Security and disability benefits were expecting more money to make up for the increased cost of living that has hung around. So yes, the government can say inflation has been coming down. It means that the rate of increase of inflation has not been dramatic as it was during COVID. However, it doesn't mean that the cost of living is still not high, and that is why people are frustrated with this tiny COLA increase. But the problem is how COLA is calculated in general. The government uses something called the Consumer Price Index for urban wage earners and clerical workers, and it's a short form of an inflation index that measures the everyday items that people in urban areas are using: food, housing, transportation, medical care, energy costs. And then they look at the third quarter, July, August, September, this year compared to the third quarter of last year. And then if prices have gone up in those categories of things they are looking at, then your Social Security benefits are adjusted upwards. Well, this year they are saying prices went up only by 2.5% in all those categories. And so they're adjusting your benefits by that amount. So some people have been saying that that is not a good way to measure cost of living adjustment, because using goods and services that urban wage earners are using does not necessarily reflect the goods and services that seniors face, or the price changes that seniors face, especially when you factor in medical costs, prescription drugs. So some Democrats in Congress are proposing that the government completely ditch the current COLA measurement formula and create a new one called the CPIE, with the E standing for elderly, which will measure price changes specifically based on spending patterns of people 62 years or older. So they've introduced 2 bills in Congress: the 2023 Fair COLA for Seniors Act, which is still languishing in Congress, and then the Social Security Expansion Act, both of which are, we don't know what's going to happen. With the new Trump administration coming in, I can bet you that none of those bills are going to move anywhere. If anything, Social Security benefits and disability benefits and food stamps are going to be under a big scrutiny, and maybe there may be cuts coming. So, if you like the video so far, hit the like button and let's keep going. Let's talk about the 10 changes to Social Security in 2025. Well, the first one has to do with how much money you are going to get. What is the average check going to look like in January? Well, the first thing is that Social Security beneficiaries are going to get an average check increase of $49, just $49, from $1,027 to $1,076. Social Security people who are a couple, so if you are the couple receiving Social Security benefits, your average benefit is going to go from $3,014 to $3,089, an increase of $75. If you're on SSDI, your increase is going to go from $1,542, which is the average benefit, to $1,580, which is an increase of $38. If you're on SSI, which is Supplemental Security Income, your maximum benefit will go from $943 to $967. And if you're a couple on SSI, your maximum benefit will go from $1,415 to $1,450, an increase of $35. These changes, as you can see, these increases are really, really small. I mean, an increase of $38 for SSDI does not even fill a tank of gas. So it's really tiny. What else is changing? The maximum benefit at full retirement age. If 2025 is your full retirement age and you're retiring and claiming Social Security and you've contributed the maximum into the system, then you're going to get an annual Social Security payment of $48,216, which is $4,018 a month. That is up from $3,822 per month. The third thing that is changing is that Social Security is funded through payroll taxes. Each year when COLA goes up, the amount of money that is the cap for Social Security taxes also goes up. Last year, it was $168,600. This year is going to be, 2025, it's going to be $176,100. If you're on disability benefits, pay attention. There's something called the substantial gainful activity that affects your benefit, especially if you are working or if you are applying for disability benefits. You need to pay attention very carefully to this, because to be eligible for benefits, the government has to determine that you are not currently able to perform a substantial gainful activity, and that is measured by a certain number. So if you're non-blind, that is $1,550 a month this year is going to go to $1,620 a month next year. It means that if you are working and making that kind of money a month for an extended period of time, you may not be considered disabled, because according to the government's threshold, you are making more money than somebody that is disabled should be making, based on their math of what they think a disabled person should be able to earn or do in terms of gainful activity. If you are blind, that number is $2,590 this year. It's $2,700 next year. If you are already getting disability benefits and you're in the trial work period where you're trying to work a little bit to see if you can return to work, that substantial gainful activity measure is $1,110 this year. It's going to be $1,160 next year. Moving on, let's talk about Medicare. Medicare Part B premium is going to go to $185. That's going to be taken directly from your Social Security check. Plus, there are some other changes that are coming up. I'm going to highlight about 4 of them so that you can see what's coming up. Medicare Part B deductible is projected to increase to $257. The maximum allowable out-of-pocket cap for Medicare Advantage plans will increase to $9,350. The Part D deductible will increase to $590, but the Part D donut hole will no longer exist. And then lastly, Medicare Part D out-of-pocket costs will be capped at $2,000 for covered drugs. If you are claiming Social Security early, before your full retirement age, and you're working, pay attention to this. There is something called the earnings test. If you're working before your full retirement age and collecting benefits, if you go above $22,320 in 2024, you are going to lose some of your benefits. For every $2 you go above that in the year, you're going to lose $1. Or if you go above it, if you make more than $1,860 a month, that number goes up next year to $1,950 a month or $23,400 a year. Now, if next year is your full retirement age year and you're working before and collecting Social Security, that threshold becomes more generous. It's $62,160 or $5,180 per month, going up from $59,520 or $4,960 per month. It means that if you go above this next year, and next year is your full retirement age year, for every $3 you make, you lose $1. So basically there are 3-tier systems if you're claiming Social Security and working. If you're claiming before your full retirement age, then you have to meet these requirements. And then if you go above it, for every $2 you lose $1. At your full retirement age year, this is your threshold. If you go above it, for every $3 you lose $1. And then at your full retirement age, once you hit full retirement age, you can work as much as you want for as long as you want and claim Social Security, and your benefits will not be deducted because you work too much. The next thing that's changing is how much you have to make per quarter to earn 1 credit of Social Security eligibility. As you may know, you need 40 credits minimum to collect Social Security. And you can earn that over 10 years if you're working every quarter and meeting the threshold. That threshold for 2025 is $1,810, up from $1,730 in 2024. Next, we have Social Security tax rate. That is not changing. It's staying at 7.65% for the employee and 7.65% for the employer match. If you're self-employed, you pay the combined rate of 15.30%. Now, the Social Security portion of that is 6.2% each. So that is good to know. In 2025, the full retirement age is going to go up for those who are born in 1959. It's going to be 66 months, 66 years and 10 months, not 66 months. And as you can see, it's been going up for a while now. Congress made a change and it's been creeping up by 2 months the last few years. Next year, it's going to go to 67, which means that in January 2026, if 2026 is your full retirement year, your full retirement age is going to be 67. That is the new limit. That was done to try to save the Social Security system, and now we're back there again. And it looks like Social Security is in trouble in terms of how fast the trust fund is going to deplete. Estimates that is going to happen in 2032, which is about less than 10 years away. So what does that mean? That's a whole separate video. But I wanted to let you know that the full retirement age is going up. And finally, the number of women that are claiming dual benefits or eligible for dual benefits. It means that they can earn benefits on their own record or their spouse's record. Between 6 and 8% of women will receive benefits solely based on their spouse's records from 2025 through 2095. Whoa. But the main point I want to make here is that more than half of females beneficiaries over 60 will receive benefits solely based on their own work in 2025. That's a huge, huge deal. And by 2095, it's expected that 70% of women will receive such benefits. So, depending on where you sit, this may be a good thing or you may not think so. But the point is that more women can now claim benefits based on their own work record than ever before. In my opinion, it's a good thing. But my opinion doesn't really matter here. I'm just here to report the facts to you, and then you make your own judgment. So here's what the chart looks like. As you can see, the percentage of women who are getting eligible for dual benefits is shrinking, and that is what the Social Security Administration is reporting. So, what do you think so far? If you like the video, hit the like button, hit the subscribe button. Let's keep going with 5 EBT discounts you should be using. Stay till the end of this video because I have 20 financial assistance programs that every senior should be using if you're low income. That's coming up right after this one. So let's talk about EBT discounts. A lot of you are on EBT benefits. There's so many discounts you qualify for. You don't use them. I'm here to bring them to you. The first one is the free diaper from, Diaper National, the National Diaper Network. So 1 in 2 people or 1 in 2 families have issues getting adequate diapers for their kids. And the National Diaper Bank provides basic necessities required to build the strong foundation for all children, families, and individuals need to thrive and reach their full potential. 1 in 2 families in the United States struggle with diaper need. The National Diaper Bank Network wants to change that. They work in partnership with their network of diaper banks, allied programs, donors, sponsors, and elected officials to end diaper need and period poverty in the United States. The National Diaper Bank Network connects and supports the country's more than 225 community-based diaper banks that collect, store, and distribute free diapers to struggling families. The network serves nearly 280,000 children throughout the country each month. If you need diapers for your kid, visit a local National Diaper Bank Network community organization near you. Visit their website to find a location near you at nationaldiaperbanknetwork.org/member-directory. Next, moving on. What is the next discount? Discounted Walmart membership. Walmart has something called Walmart Plus, which is similar to Amazon Prime. It functions the same way. You get some benefits, free shipping on certain things, and certain perks. Well, they're giving people on EBT a 50% discount on the membership, which is similar to what Amazon has been doing with Amazon Prime. So Walmart now offers a new Walmart Plus Assist membership for those receiving SNAP, WIC, and Medicaid. Get the Walmart Plus Assist membership for just $6.47 or $49 a year. That is over 50% savings. A Walmart Plus membership helps save time and money with benefits like free shipping, grocery delivery, discount on fuel, free video streaming with Paramount Plus, much more. Get a complete list of discounts that come with your Walmart Plus membership on the next page. Here we go. So you get free groceries and grocery delivery, 10 cents a gallon at 14,000 gas stations, including Exxon, Mobil, Walmart, and Murphy. Free video streaming with Paramount Plus, free at-home return pickup. So if you want to return something, they'll come home and get it. Early access to special prices, product releases, Black Friday deals, and more, and access to Walmart Plus travel, etc., etc. What is good about this is that you can get a 30-day free trial. So there's nothing to lose here. Sign up for a 30-day free trial. Try the Walmart Plus Assist program. And if it's worth it, then you can continue to sign up for it and use it. I mean, if you shop at Walmart, why not? Discount number 3, which is one of the biggest one. Access to amazing places at a discount. If you currently have EBT, you are eligible for free or discounted admission to 1,200 museums through the Museum for All program. Museum for All removes the financial barrier of low-income families and encourages individuals of all backgrounds to visit museums regularly and build lifelong museum habits. The program includes a variety of museums, including art museums, history museums, natural history, anthropology, general museums, children museums, science centers, planetariums, nature centers, historic houses and sites, zoos, aquarium, botanical gardens, and more. If you have one of these EBT cards, you qualify. And participating locations offer free admissions or just $3 per person. That is an amazing discount, and you can use one EBT card and get 4 people in. So you yourself and 3 other people in your family to visit these amazing places, go to museumsforall.org. Again, if you enjoy what you're hearing, hit that like button and let's keep going. Discount number 4 is discounted Instacart membership. As you know, Instacart helps you buy food and other stuff, and they bring it to you for delivery. Well, now they are offering a discount to SNAP recipients because now Instacart is available at 95% or within reach of 95% of the 42 million people that are enrolled in food stamps. And so, all you have to do is sign up. They're giving you their membership at a discount for $4.99 a month for 1 year. And what they are trying to do is get a lot more people on food stamps to be able to get the convenience of being able to shop for groceries and get it delivered to them at a cost that does not really break the bank. So that's what this is about. Sign up if you are interested. And discount number 5 is free laundry service. This is one of the exciting ones that I know a lot of people do not know existed. Laundry Love is a non-profit organization that washes the clothes and bedding of low-income families and individuals across the United States for free. They brighten the lives of thousands of people through love, dignity, detergent by partnering with diverse groups and laundromats nationwide. The Laundry Love initiative helps people struggling financially by assisting them with their laundry. Laundry Love partners with groups and local laundromats in cleaning clothes and linens of low-income or no-income individuals and families. They see the laundromat as a place where strangers become friends, people are known by their name, hope is hustled, and the worth of every human being is acknowledged and celebrated. They've completed over 2 million loads of laundry and helped more than 1.5 million people since 2003, with an estimated 100,000 people cared for annually. So to get a free laundry assistance, find a Laundry Love location near you. Go to laundrylove.org/location to find one. And then I have a free bonus discount that you may not know about. Free eye exam and eyeglasses. Vision Eyes of Hope, provided by VSP, provides access to no-cost eye care, eyewear, and disaster relief in places where it is needed the most. VSP Vision believes that eye care is essential. Eyes of Hope addresses barriers of income, distance, and disaster to provide equitable access to eye care and eyewear when it's needed the most. To date, they have provided access to no-cost vision care for more than 3.8 million people. If you cannot afford eye care or you don't have access to it, VSP Vision of Hope can help you. They help adults and children access free eye exam and glasses at no cost. Eyes of Hope offers gift certificates, mobile clinics, and disaster relief to those in need of eye care at any age. To qualify, the family must meet 200% of the federal poverty level. You currently do not have coverage through a private insurance or a government program, and you have not received a VSP Vision program for the past 12 months. Gift certificate provide coverage for eye exam and complete pair of prescription glasses with single vision or line multifocal lenses. Gift certificates are distributed through their national network of community partners. If you're a student through ages 19, contact your school nurse. School nurses and administrators can request a VSP Eyes of Hope gift certificates through their one of their educational partners, including the National Association of School Nurses. And any adults and children of any age can contact one of their community partners, including Unidose, and let them know that you need vision care. Or you can call them at 800-877-7195 or visit their website at vsbvision.com/eyes-of-hope. This is an amazing program that I encourage everybody that's struggling with vision care, eyewear. Contact them because it is an amazing, amazing, supportive program. So as I promised, we are towards the end, and these are the 20 financial assistance programs. I received so many questions from seniors about help specific for seniors. So I've done extensive research. This is part 1 of this series. I'm going to give you a ton of information on financial assistance that are targeted specifically at seniors. So here are 20 of them. Let's get started. The first one is Senior Community Service Employment Program. It provides job training and part-time employment for seniors. It focuses on community services role. You have to be 55 plus to be eligible, and your income has to be less than 125% of the federal poverty level. Why does this exist? It helps seniors stay active and earn income. So that is the web address to visit to inquire more about this. Next, tax relief for seniors includes federal elderly tax credit for seniors with limited taxable income. State programs may offer relief on property taxes, sales, or income taxes. Renters can also benefit in states with renter-focused tax assistance. And programs ease the financial burden of the annual tax filings for seniors. So if you want to take advantage of this, visit your state's tax office or consult a tax advisor for details about tax relief for seniors. Now let's go to the next program. State Pharmaceutical Assistance Program. Let me move these things out of the way so that we can see the title clearly. There we go. This helps cover medication costs, filling gaps left by Medicare. It's available in several states with varying income limits. It works alongside Medicare Part D, so visit your state-specific website for eligibility, or you can go into the web address that I've listed below to get more information about this. The third discount or financial assistance program is free discounted transportation programs. These are non-emergency transportation to medical appointments and community centers. Programs like Access a Ride or Dial a Ride or even Neighbor Ride cater to low-income seniors, often funded through local transit agencies and senior centers. Eligibility varies. Proof of age or income may be required. Inquire with your local area agency on aging. Section 202, supportive housing. You may not know this, but the subsidized federal housing grants for seniors with low income includes on-site services such as transportation and meals. Rent typically cannot exceed 30% of your income. It's for people 62 years plus with limited assets, and you can apply via HUD-approved agencies or use the web address I have provided below. Low-income energy assistance pays for heating and cooling, reducing utility bills for seniors. It covers weatherization services to provide and improve home energy efficiency. Income limit, you cannot make more than 150% of the federal poverty level to qualify for this energy assistance. And they offer crisis assistance for energy shut-off emergencies. So you can apply through your state's energy office or go to this website and learn more. Number 7, a program I'm really excited about. Silver Sneakers offers free fitness programs through Medicare Advantage plans, access to gyms, online classes, and wellness programs. The one you see is a standing Silver Sneakers class. So there are programs where you sit and you exercise. So there's many good programs focused on maintaining physical health and reducing healthcare costs. Check eligibility with your Medicare provider, especially if you have an Advantage plan. Low-cost internet for seniors offers discounts on internet and phone services. You have to make less than 135% of the federal poverty level to qualify. You get a credit of $9.25 each month towards your internet or phone bill, and it focuses on digital inclusion for seniors. For details, go to lifelinesupport.org. And then we have state property tax relief. This is a huge problem for seniors that have paid off their mortgages, they are on limited income, and are struggling to pay their property taxes. This offers tax exemptions, deferrals, or freezes specifically for senior homeowners, helps reduce or delay property taxes to protect home ownership, and eligibility varies by state. often requiring proof of age and income limits, focused on seniors remaining in their homes without financial strain. So the example I showed here is from the state of Montana, advertising a similar program. Number 10, Medicare savings plans assist with Medicare premiums, deductible, and co-insurance. Includes programs like qualified Medicare beneficiary and the specified low-income Medicare beneficiaries. You cannot make more than 135% of the federal poverty level, and it saves seniors on average $1,600 in healthcare costs. So this is a huge, the table I've shown provides details on who is eligible based on the Medicare program that you are partaking in. 11, Supplemental Security Income Energy Assistance. If you're on SSI and you're a senior, you can get automatic eligibility for energy bill assistance when you're enrolled. It provides grants or discounts to heating and cooling expenses. Participating utilities offer special rates or discounts for SSI recipients, and seniors can combine the low-income heat and home energy assistance program credit with the Social Security SSI energy assistance for maximum savings. So if you're on SSI, you're eligible for special heating assistance or energy assistance programs in your state, and there is the low income heat energy assistance program that is federally funded, and sometimes you can combine both programs and get more benefits and save more money on your energy bills. Then there is a Seniors Farmers Market Nutrition Program. It offers vouchers for purchase of fresh fruits, vegetables, herbs, and honey accepted at farmers markets, roadside stands, and community farms. You cannot make more than 185% of the federal poverty level to be eligible, and it encourages access to healthy, locally sourced food for seniors. You can contact your state's agricultural department or go to the website below for more details about this program. Next, we have the Commodity Supplemental Food Program. It provides monthly food boxes, including staples like grains, canned vegetables, and dairy. Aims to combat food insecurity among low-income seniors 60 plus. Eligibility, you cannot make more than 130% of the federal poverty level, and the distribution is managed by the USDA through local agencies. So for more information, contact USDA offices for details on this particular program. Next, we have Social Security Supplemental Security Income. A lot of seniors don't know that you can get Social Security benefits and get SSI if you are low income. If you are receiving a tiny Social Security check that is not really livable, you can qualify for SSI. SSI is not just for disabled people, it's also for seniors who are 65 and above and need help. So as you can see, the table that I've shown, there's a large majority of seniors, 25% of SSI recipients are seniors, and you can get both. Monthly payments for low-income seniors ages 65 or people with disability, you can get up to a maximum of $967 for an individual and $1,450 for a couple. Some states add additional money to your SSI's benefits. I think California does that. Strict income and asset criteria apply, however. For more details, go to socialsecurityadministration.gov to get more details. Moving on, number 15, hard mortgages, reverse mortgages. I'm going to give a lot of caution here because I am not a big fan of reverse mortgages, but I'm here to report the facts and you make your mind up about it. But I'm cautioning that this is not something you go into lightly. It converts your home equity into cash for seniors to use as needed, does not require repayment until the home is sold or vacated. Eligibility, you must be 62 and homeowner with substantial equity. It provides financial relief without selling the home. You can apply by a HUD-approved agency. That's the information. You have to go through HUD-approved counseling to get the loan. But here's the risk. Failing to pay property taxes, homeowners insurance, or maintain a home can lead to foreclosure. So make sure that you are doing that even when you're getting this hard reverse mortgage. And high cost and reduced inheritance. Reverse mortgages have upfront costs. upfront fees and interest that accumulate over time, reducing the equity left for your heirs. So if you are trying to leave money for your kids or your children, this is not something you touch lightly. You have to make sure that you're going into it with clear eye, are going to go with a hard approved agency, and go to the hard counseling to make sure that you understand everything about this, because your home essentially does not become yours anymore once you touch this. So proceed with caution. Meals on Wheels delivers nutritious meals to homebound seniors, prioritizes those unable to cook or shop due to mobility issues. Volunteers visit and offer social interactions and wellness checks, and eligibility and fees vary by program. Visit Meals on Wheels America.org. Housing Section 8 vouchers subsidizes rent for low-income seniors, ensuring they pay no more than 30% of their income on housing. It prioritizes seniors, disabled individuals, and families with children. You cannot make more than 50% of the area median income, so it varies by locality. Long wait lists usually come with this program, and early application is recommended. You can apply with your local housing authority. Number 18, Aging and Disability Resources Center. This is an amazing resource. It's sponsored by the federal government through the United States Department of Health and Human Services. It connects seniors to local, state, and federal benefit and resources. Services include care coordination, healthcare navigation, and housing assistance. It's designed for those needing long-term services and support. You can get a free consultation with one of their trained staff, and to locate a center near you, find them on this website at acl.gov/everything I have provided. Number 19, Medicaid. Comprehensive healthcare coverage including doctor visit, hospital stays, and nursing home care. It covers in-home health care and long-term care for qualified seniors. You cannot have more than 138% of the federal poverty level by income, which varies by state. That threshold varies by state. And dual eligibles may receive Medicare and Medicaid Medicaid benefits. Apply through your state's Medicaid site, but it's important to understand that there's a difference between Medicare and Medicaid. Medicaid is a federal-state partnership for adults and children who meet the state's income requirements. However, Medicare is for seniors who have paid into the system. It's a federally run program for seniors 65 plus or for qualified people on disability. And then finally, food stamps. This is something that I know a lot about. I've been talking about for years, almost, a decade and a half now. Monthly funds are provided to you via EBT benefits. Your qualification depends on your household income and assets and number of people in your household. It covers essentials like fresh fruit, produce, dairy, meat, and you can apply to your state-specific food stamps office. There is no shame in getting food stamps. That's one problem that I see with a lot of seniors, is that they feel a stigma that if they're getting food stamps, they're taking benefits away from somebody. You're not. 50% of seniors who qualify don't get the benefit or don't apply because of this reason. You're not taking benefit away from anybody. If you apply and you get it, you get the money. And it does not mean that you have failed. It's just that you've hit a hard time and you need help. And you see the table below, or the table on the right hand side. You can see how much maximum you can get. Maximum you can get each month. A family of one, you can get $292. A family of two, you can get $536 towards groceries. Again, it's the maximum, not the average. So yours may be less, but that's the maximum you can get that is being showed on that table. And the income limit for this particular state, which is Maryland, which is my state, you can see it's all listed there. So, what do you think about these financial assistance programs? Are there any of them that jumped out at you that you've used before or you plan to lose or look into? Did anything at all trigger excitement in you that you're like, you know what, I am going to look into this program? Let me know in the comment section below. hit the subscribe button, hit the like button if you liked what you heard today. Until I bring you the next video, which I'm looking forward to, thank you for watching today's video.